Hi, this is Dr. Root Monica Gill from Pulsar Health in West Palm Beach. Everything has been so serious lately, and I finally got my hair done yesterday, and after 5 months, and I had a massage and felt so much better. So I want to talk about beauty today because everything's been so serious, and beauty can really make us feel good. So today's topic is on lip fillers. I'm going to share my screen. I did a little PowerPoint using clients that I've had over the past week. There's 3 clients that I did lip fillers on, and I want to share what kind of things that I look for and how I assess people and what you can look for if you want to go and get a lip filler done. So this lady, actually, I worked on her today, and these are her immediate results. She took this picture at home earlier today. And when she came in, I look at what person wants overall. She had lip fillers done a few years ago, and she thought, and I had actually worked on her sister, and she loved it, and so she came in to get her lip filler done. But I also did a full analysis because I like to recommend what I think is in their best interest. And so we did a Visia skin analysis, which I'll share with you some other time. But it basically looks at sun damage, pigmentation, redness, your pore size, all of that. And so from her analysis results, I recommended sunblock. It is so important as an essential. She also elected to get a little bit of Dysport, and we'll talk about that later, but to avoid wrinkles around her eyes. Her forehead is responding very well to prior Botox and Dysport, but she was also interested in lip filler. I recommended Vivace to her too, which resurfaces the skin, and that will help with a lot of the fine lines and wrinkle areas, as well as even out the pigmentation. And again, I'll talk about that some other time. But today we're just focusing on lip filler. She did require 2 syringes to get this look. This is a client I had about a week ago, and she required 1 syringe. This is immediately post. There's a little bit of blood. Don't be freaked out. I was going to share a video, but I thought people might not like seeing injections go into skin, so I held off today. But you can see that we have evened out the height of her lip and balanced the upper and lower lip. And this is another client that I did last week who took a picture a day after and sent it to me. And again, I evened out her lips and balanced the size. So I use different fillers for different reasons. The last client that I showed, she had Define. Define is a firmer filler, and it helped build the height for the architecture. Refine is a softer filler, and that was the one I used for the client before. And Kiss is a new filler that's sort of a kind of an amalgam between the two. It's been around in Europe for quite a while, but it's new to the States. It just came out during Corona, so it's very new. These are other fillers. Restylane Lift we don't use on the lips, but it is used more on the cheeks and can be used on the hands to rejuvenate the back of the hands. Silk was the first FDA approved filler for the lips, and this is the original Restylane. So my choices for lip filler these days are these 3. These are the ones that I go for. This is for more that I use for softening the lips. This is when I want to emphasize the lines around the lips. Oops. We move far ahead, and then this is it's one for that I use for younger lips. So the Restylane is one of the big 2 companies that are well branded. The other one is Juvederm. Restylane is from the Galderma, and Juvederm is from Allergan. There are other companies on the market, such as Revenus Versa, and these are less expensive. They all have hyaluronic acid, and hyaluronic acid is a filler in terms of it's a substance that is between the cells. Collagen is a protein that's between the cells. Hyaluronic acid is a sugar molecule that's between the cells, and it attracts water to it. So they're all different formulations of hyaluronic acid as fillers that I've shown here that we use for the lips. There's other types of fillers which we'll cover some other time, but these are for lip fillers. And so this goes to show the power of branding. Revenus is not as well known. It's a Canadian company, and they are not charging as much for their lip fillers as the bigger branded companies. So I'm going to share my screen again with you guys, and moving on to, let's see, the I don't use the Juvederm because I tend to stick with the Galderma family. There have been some reports of chronic granulomas with some of the Allergan filler products, and so I've just stuck with the Galderma products. So these are not my pictures, these are from online, and this was one of the Allergan family, which is one of those two big families that I talked about, Allergan and Galderma being the two big ones. And Juvederm is an Allergan product, and you can see that this young lady has a nice result that's long lasting. So fillers should last at least 6 months in the lips. The more you move an area, the less length of time things tend to last. Areas such as the nose or the cheeks tend to last a lot longer. This is Restylane, which is the other family as well as Allergan. And fillers can be used all over the face. As I said, the cheeks is an area. I like to use it on the cheeks, and I like to use it in the lips, but I don't like to use it in other areas, like these sort of fine line, these lines and marionette lines. I prefer to do other things in those areas because I don't like a heavy look of the lower face. People use fillers for this area, but it tends to give you what's called a simian look, which is a monkey-like look, because it gets heaviness there. And I want this area to be scooped in, this area to be pooching out, and to have the lovely curves that we want in a youthful face. So I prefer to try to work on lifting these areas with threads or other modalities like the Vivace, which has a radio frequency tightening element, as well as the microneedling, to tighten and smooth out these areas. Obviously, skincare products help too, but the machines tend to be more powerful. And to get those kind of results in these areas rather than using filler. But other people obviously use filler in those areas too. The under eye area, people have used fillers, of course. I prefer to use a very thin filler if I need it, called escaping me now. Bella begins with a B. It's from Merck Company, and or PRP, which is platelet-rich plasma, which is what I prefer. And the PRP takes at least 3 treatments monthly, but it actually can begin to resolve those dark circles and have a long-lasting, if not permanent, effect. So when you're having a discussion about what fillers to use, think about like the big picture. And so that is it. Today is short and sweet. As you can tell, fillers can make you feel like you got your bubble back and really give you an instant gratification. So I encourage you to feel good and to look after yourself and have a great rest of your week. Okay, bye-bye.